I'm Dr. Lee Meals with Meals and Tolar Impairment Specialist. We're located in Paducah, Kentucky, and we provide impairment ratings for the Department of Labor for the Energy Employees Occupational Illness Protection Program, and we take care of impairments all over the country and are glad to help anyone who needs an impairment. My father worked at the Paducah Gaseous Diffusion Plant for over 30 years. I worked there as a summer student in the late 1980s in health physics, and you hear claimants say, I was all over the plant. I literally was all over the plant, going into areas, contaminated areas, and scanning and trying to help other employees come out of contaminated areas in a secure, safe way. And that was my hands-on experience, and really saw in person what these people were, the conditions in which they were working. So I've practiced internal medicine in Paducah for 25 years. I've been a practicing physician for 28. I was in a large medical practice with my sister-in-law, Dr. Tolar, and we were both providing primary care to workers of the Paducah Gaseous Diffusion Plant who were covered under the law. And many of them were going to get their impairment ratings done, and then as they got older or became more debilitated, it was very difficult for them to have those ratings done. So I said to her one day, I think I'm going to get certified to do the impairment ratings. My patients really can't leave to go have that done anymore. And she said, I'm going to do it with you. And that's kind of how it started, is really just to help the people in our own community. And next thing we knew, we were getting referrals from East Tennessee and South Carolina and Georgia and Florida. It just kept growing, and so it's been very exciting to be a part of it. The impairment rating for this program is designed to be obtained from the American Medical Association's impairment rating textbook, 5th edition. It's very specific that the law was written that only the 5th edition be used for the impairment rating. And so we're both certified according to the 5th edition to provide the impairment rating. Impairment rating is not a disability rating. Many people are concerned, maybe they are retired and they've got a little part-time job somewhere, and they don't want the impairment rating to affect their current employment. Maybe they're young and still working at one of these facilities, and they are concerned that their impairment rating will affect their employment. It will not. We are not determining if you are disabled. We are saying, based on the American Medical Association's Guides to Permanent Impairment, the 5th edition, how much that condition affects you as a whole person. And those guides are very specific for most of these conditions as to how to determine what that rating is. So the impairment rating is important not only because you're entitled to it, but it comes with compensation as well. You're entitled to an impairment rating if you have a medical benefits card, unless you worked at a facility that may not be entitled to Part E of the law, or if you have a condition that is only covered for medical benefits only. Your claims examiner can let you know if you are entitled to an impairment rating based on the condition in which you've been approved for and based on the facility in which you worked. Those who qualify for an impairment rating are those who have received a medical benefits white card from the Department of Labor. You probably know the conditions that have been accepted and those that have not. Sometimes while you're waiting for us to complete the impairment rating process, maybe you've requested it. We're still waiting on records. Sometimes that claim that was still in process, or possibly a denied claim, gets overturned and gets accepted, and we'll be glad to pick it up and put it on that impairment. That's not a problem. There are a few exceptions to those who will not qualify, or a few conditions that will not qualify. Claimants that worked at certain facilities are not eligible for the impairment rating, which is Part E of this law. And then there are certain conditions. You may have certain conditions that do qualify for impairment and some conditions that do not. And so some of those conditions are only eligible for medical benefits but not impairment. Question we are often asked is, how long will it take for me to get an impairment rating? Once we receive your authorization letter from the Department of Labor, we will start to collect records from you. We'll send you a letter with the things that we need. Again, the more you do on your end to gather those records, the quicker we can get you to the scheduling process. We have multiple stages within our office where your paperwork follows a trail. If you need records obtained, if you need tests scheduled, those things will take time, and then it takes time for us to get those records back. Once we have everything that we need to move forward with the interview, which is done over the phone in approximately 30 minutes, give or take 5 or 10 minutes, you will be scheduled, and usually our scheduling is about 6 weeks out from the time that you are notified that we're ready to schedule.